Hi, this is Srividya. I welcome you all to my channel on cardiac essentials. Well, in today's world, there is stress, whether it's a personal life or professional life. Stress is like inevitable. There is some point, like some amount of stress always, there, and it is how well we are able to carry ourselves and maintain a healthy living. And when there is a stress has a greater impact on the heart, like especially the hypertension, the high blood pressure. So it can have a very heavy load on the heart, like it can lead to left ventricular hypertrophy, where the left side of the heart, the left ventricle muscle of the heart becomes thick, and this happens because of high blood pressure that forces the heart to work harder to pump blood. And when it becomes harder, this has an adverse effect. The muscle of the heart thickens, and you see like the enlargement of the heart. So LVH is a very high risk factor for cardiovascular diseases, which can lead to heart failure or even sudden cardiac death. So we might be wondering, how can we control the hypertension? High blood pressure is the main reason for this LVH. There are other reasons contributing to it, and this can be controlled by drugs, medications, and long-term high blood pressure places a strain on the heart muscles, leading to the thickening of the left ventricle, indicating that the heart is under stress, and which may result in the heart not able to pump blood efficiently. So, like I said, it's a high risk factor leading to heart failure, stroke, or even sudden cardiac death. And sometimes the symptoms are asymptomatic, like there are no symptoms visible, So it's a high risk factor. And controlling blood pressure, so you might ask, how do we control the blood pressure? Through lifestyle changes and medications. It is reversible, detected in the earlier stages. It is reversible to the normal size and function. So one factor is the high blood pressure. And I stated before, stress is a inevitable part of life, whether it is professional or personal. Some amount of varying stress will be there. It is for us how effectively and efficiently we are able to maintain ourselves, And high blood pressure is a very risky factor and should never be ignored. Besides hypertension, aortic stenosis can also cause left ventricular hypertrophy. So when you are talking about aortic stenosis, it's narrowing of the aortic valve. So how do we come with this diagnosis? Is we do some tests like electrocardiograms, ECG, echocardiograms can detect LVH even before they could appear. And mainly, once the diagnosis is done, the treatment has to be strictly adhered to, like the diet and exercise, lifestyle modifications, and the medicines to lower the high blood pressure, wherein it reduces the stress on the heart. When you talk about the Stress, it's basically reducing the workload on the heart. So one has to be very careful when talking about high blood pressure. It should not be ignored. Okay, I have high blood pressure, I'll just take a medication, try to lower it, let me stick on to my routine. Please don't do that. If consistently you are experiencing high blood pressure, it is only advisable to go meet a medical practitioner, a cardiologist. Or you can, if it is really high, then it is good to go to the ER, because ER specialists are known for handling cardiac emergencies. Like I said, LVH can lead to cardiac arrest and even silent cardiac death or heart failure. So when we are talking about high blood pressure, that is the main thing which causes the left ventricular hypertrophy. In left ventricular hypertrophy, the heart's left ventricle muscles, so hypertrophy is like heart's left ventricular muscles thickens, it becomes thick, and this can be then the heart has to put extra effort to pump blood. So the extra effort causes stress on the heart and results in thickening of the ventricular walls. So when blood pressure is consistently high, the heart's left ventricle works harder to pump and circulate blood throughout the body. So the pressure increases. This increased workload can cause the muscle of the left ventricle to thicken, leading to LVH. And LVH can make it harder for the heart. Like we stated before, any time you think it's the efficiency of the heart to pump blood, it needs more work to be done to work efficiently. So causing stress on the heart, leading to heart attack, stroke, and other cardiovascular problems. So the basic thing that has to be noted is the high blood pressure. The primary cause, I would say, is the high blood pressure. But as well, the other contributors can be the aortic wall stenosis, where the narrowing of the valve, or hypertrophic cardiomyopathy, or intensive athletic training, athlete's heart, they say. So these are also the major contributors to left ventricular hypertrophy. So not always we can say this will have noticeable symptoms, especially when we are talking about the initial stages, when symptoms do occur. So you might be asking, what are the general symptoms of LVH? So like suddenly when you are experiencing a shortness of breath, or you feel fatigue always, and experiencing chest pain with exercise, feeling rapid beat of heart, the heart palpitations, and having a feeling of dizziness or fainting. These are the symptoms of LVH. So how do we treat LVH, and what are anything you have to treat, do a root basic, you have to come up with what's the underlying cause, what is the main cause of LVH, how that can be treated. So this can be treated with the proper management of the high blood pressure through lifestyle changes, the diet, exercise, and proper medication. LVH can be corrected, treated, and it can be reversed. So the best thing is not to take high salt content like you can stick on to, like I said, the diet chart: fresh fruit salads and vegetable salads, low sodium diet, and avoiding tobacco, smoking, low consumption of alcohol. This all could lead to a healthy heart. So like I said, the most common cause is the high blood pressure. High blood pressure can be a result of many things, like it can be your day-to-day stress, and it has to be well maintained, and there can be like many things, not just when you talk of high blood pressure, it can be many things. So it is also known as hypertension. When you talk about high blood pressure, it is the increased pressure the heart must take to work against the hypertension, leading to thickening of the left ventricular walls. So basically the heart's pumping chamber becomes thicker than normal, making the heart put extra effort to work or pump blood. So when there is too much of stress because of high blood pressure, it becomes very hard to pump blood throughout the body for the heart. So whatever the extra effort is put causes the heart muscle in the left ventricle to thicken over time, which can be reversed by proper medications, like I said. So the most common factor is hypertension, but there can be other factors like aortic valve stenosis, and also certain genetic conditions too. So when we are talking about LVH, it's a high risk factor and it should not be ignored. It can lead to heart failure, stroke, or cardiovascular issues. So the main thing is treating the hypertension, high blood pressure. And so with this, I'm just going to end today's video on left ventricular hypertrophy. Basically, when you are talking about left ventricular hypertrophy, you should know that the left ventricle of the heart wall thickens because of the stress on the heart, and it's primarily caused by high blood pressure, hypertension. So the heart has to put, like I said before, the extra effort to pump blood throughout the body, and gradually the heart wall, the left ventricular wall becomes, the heart muscle wall becomes thick. So with this, I'm going to end today's video, and I would advise, like, stick on to your medical chart, like whatever the prescription is, and if you still feel like the high blood pressure is, there's a consistent rise in blood pressure, you have to go to a medical practitioner. And if you experience like shortness of breath or chest pain, it's advisable to go to the nearby ER, because there are ER specialists who can handle it depending upon the severity of the present condition of the heart. So the heart's main pumping chamber is the left ventricle. When it becomes thick and due to strain of high blood pressure, it's not able to pump blood. It needs more effort to pump blood against elevated pressure, which causes the heart to enlarge. So when there is a thickening of the heart, it can have an impact on the heart's ability to pump blood, like I said, effectively, leading to a heart attack, heart failure, and stroke. So you might be thinking and asking a question: can stress and anxiety cause left ventricular hypertrophy? Anxiety, the psychological stress caused by anxiety disorders also increase circulating catecholamines, through the hypothalamic pituitary adrenal axis. So with this, the time constraint, I'm going to end up the video here. Please stay tuned up, and if you like my videos, do subscribe to it. Wishing you all a healthy life. God bless and thank you.